Thank you, Madam Chairwoman. Lessons learned from the pandemic. There's several things that I'm going to try to get through in a short time. Several of the hospitals in West Virginia have indicated that they seem to have increased efforts to hack into their hospital records. I don't know whether that's unique to West Virginia. Has it been for any that went on the panel? Have they seen that across the country during this pandemic, that people were trying to get access to health records? Can anyone comment about that just quickly? Hearing none. Let me go to Austin.
This is
if I could,
Dr. Ranney, just to say that the issue of cyber attacks on healthcare records is an issue that's been going on for a very long time, and I can provide data from Dr. Paraxis.
Increase, has there been an increase in this? That's what I'm trying to get to. So if I could,
I'm not sure. I will find out.
Okay. To Austin down in Emory. We've had, my wife was a critical care nurse for 45 years, and we've known about this shortage of nursing care for some time. But during the pandemic, there was a call or demand for increased nursing care, and so the traveling nurses really took off on this. And so hospitals like Emory or all the way, the larger hospitals all across America are paying, I know we have records of it, as much as $200 an hour for the first 1,000 hours that they work. That's exacerbating the shortage that Schakowsky just talked about. Larger hospitals can afford to pay that. But rural hospitals like we have in West Virginia and in Eastern Ohio or elsewhere, rural areas, can't compete with that. They're being robbed of their nurses. So I'm curious, what is the solution? They can't afford to pay more, or they would have been doing that. How are small hospitals supposed to exist during a pandemic when their nurses are being robbed to go someplace else? Can one of the panelists comment about that?
Thank you for that question. I'm happy to. I'd like to acknowledge and thank your wife for her many years of nursing service. I think that's the question that you asked is a question that all hospitals are asking themselves, whether it's a rural hospital or a larger hospital in a metro city. One thing I talked about earlier is the ability to bolster any types of training programs to actually increase the nursing pipeline. I think could be really helpful. That way we can decrease, I think, the dependency on contract labor. Contract labor is not sustainable. In my healthcare organization, we are having a lot of conversations about how to mitigate the labor costs for travelers. I mean, it is, in the beginning, it's meant to be a very temporary way to supplement, say, nurses that are on leaves of absences. It is not a way that we want to staff our hospitals because, again, I say it's just not sustainable.
Thank you very much. Let me reclaim my time. I'm trying to get two quick questions. During the pandemic, also, there was a shortage of PPE. And we were seeing companies like Premier that were trying to level out to make sure that it was distributed. But yet this committee, or the Energy and Commerce, has before it a bill that's going to restrict it. We know we need more plastics, but yet we have in this committee an effort to try to restrict increased plastic production in America. It just doesn't make sense to me. So what they're talking about it was a Clean Future Act under Section 902 says for the next 3 years there will be no new plastic manufacturing in America. I think it just befuddles me as to why we would do this when we need the plastic. But Dr. McBride, I want to turn to you just at the last of it and say, because of the children with mental health, I'm curious to see what we're saying for schools. Are we going to continue to depend on our teachers to try to take on the mental health issue? Can you talk to me a little bit? Because this is very frustrating when I see, as we come through the pandemic, how we deal with this.
Absolutely. I mean, teachers are some of the unsung heroes of the pandemic.
Yes.
We owe a debt of gratitude for our frontline health workers, our essential workers, our teachers. We cannot ask teachers to be mental health providers. I mean, I think one of the reasons, at least the teachers I know and care for as patients go into teaching is to be not only someone who educates children, but also a mentor and a guide and provide emotional support. But in order to help children recover from the stacked stresses of the pandemic, regardless of their lived experience. And in order to bolster their mental health moving forward, we need to make sure that educators are aware of mental health issues. And here's an idea that one of my friends works in DC here. She's a pediatrician, and her clinic is annexed to Anacostia High School. If we can build in primary care and annex it to schools, particularly schools in marginalized, underserved, often urban communities, where people can get vaccines, where they can get basic primary care, and they can get access to truthful information right in the school setting. That would do a lot to bolster the mental and therefore physical health of children and adolescents. Make it easy to get access to mental health care, even at school or annexed to school, because teachers cannot do, they're wonderful, but they can't do everything.
Thank you.